2 months pregnant with cold, runny nose, cough, and sore throat. Is my baby at risk? Hi Huyen 1998. Common colds. Common colds are typically characterized by symptoms such as runny nose, sneezing, nasal congestion, dry or phlegmy cough, sore throat, and mild headache. Colds usually don't cause a fever or only a low-grade fever below 38 C 100.4 F and typically resolve within 710 days. Common colds generally do not pose a significant risk to the developing fetus. Influenza the flu. Influenza the flu is a viral infection, often more severe than a common cold. Besides the symptoms of a cold, like runny nose, cough, and sore throat, the flu can also cause high fever above 38 C 100.4 F, intense headache, muscle aches, fatigue, nausea, and diarrhea. The flu can pose a potential risk to the fetus, especially during the first trimester, and may lead to birth defects. To determine whether you have a common cold or the flu, it's essential to consult a doctor. A specialist in internal medicine can conduct a physical examination and tests to make an accurate diagnosis and recommend appropriate treatment. Key points to remember: avoid self-medicating without your doctor's advice, especially during pregnancy. Stay well hydrated by drinking plenty of fluids. Get ample rest to support your immune system. Maintain a balanced and nutritious diet to boost your body's defenses. Key points to remember: practice flu prevention measures like frequent hand washing, wearing a mask in crowded areas, and getting an annual flu shot. Additionally, for further guidance on your health and your baby's well-being, consider consulting with specialists at reputable hospitals like National Maternity Hospital, Tu Du Hospital, Ho Chi Minh City University of Medicine and Pharmacy Hospital. Wishing you and your little one all the best.